Speaker, adrenoleukodystrophy or ALD is a rare X-linked genetic disorder affecting approximately 1 in 15,000 to 25,000 newborns worldwide. It primarily affects males, although females can be carriers and sometimes develop symptoms later in life. ALD causes a harmful build-up of long-chain fatty acids within your nervous system and adrenal glands, and leading to severe life-limiting conditions. It can present in several forms. Cerebral ALD, which is a rapidly progressive neurological condition appearing in childhood, adolescence or adulthood. It causes behavioural changes, learning difficulties, vision and hearing loss, seizures, loss of coordination and eventually dementia. And without early intervention, the neurological damage is largely irreversible. Adrenomyeloneuropathy, or AMN, typically emerges in adulthood, affecting the spinal cord and peripheral nerves, leading to leg weakness, muscle stiffness, gait problems, bladder and bowel dysfunction, and chronic pain. And primary adrenocortical insufficiency, or Addison's disease, which is impacting on the adrenal glands, causing fatigue, weight loss, nausea, vomiting, and skin darkening. And untreated, it can also be life-threatening. Speaker, early diagnosis is critical. Stem cell transplants can be life-saving for males with cerebral ALD if performed early, while hormone replacement therapy manages adrenal insufficiency. I know this reality well. In 2022, our son Seamus underwent a stem cell transplant after careful monitoring with regular MRIs since 2016. These years of vigilance, anxiety and hope have been an extraordinary journey for our family. Tragically, we've also farewelled two of Seamus's cousins to this devastating condition, and witnessing their struggles and navigating complex medical and support systems has left a lasting impression on me. Families living with rare conditions like ALD face significant barriers in accessing care and support. Genetic diseases in Australia have always been fraught with obstacles. Not only is there the physical or mental illness to contend with, but the ongoing struggle for diagnosis, treatment and support. Individuals and their families are navigating a fragmented and at times expensive system in a quest to find answers. People are faced with red tape, cuts to essential therapies and persistent challenges accessing the NDIS, a scheme that was built to support, not exclude. We must move towards a collaborative, holistic care model that supports families from the moment of diagnosis. Too many receive devastating news and are left to navigate complex systems alone. With ALD, rapid testing from the Australian Leukodystrophy Clinical and Research Program is using new technologies to help reduce the number of undiagnosed cases, whilst the Murdoch Children's Research Institute is collecting comprehensive data to better understand white matter disorders, tracking disease progression and testing new treatments. Massimo's mission, supported with a $3 million grant from the Medical Research Future Fund, provides comprehensive research linking diagnosis and clinical treatment for leukodystrophies. I would like to highlight and acknowledge the work of Claire Kingsley from Leukodystrophy Australia. Claire is a dedicated advocate and social worker who ensures that families have the support they need to navigate difficult diagnostic and therapeutic situations. Claire has consistently emphasised the critical importance of access to research and drug trials. She explains, Australians are missing out on life-saving drug trials and research that are kept to the Northern Hemisphere. The Australian government needs to assist and entice drug companies to seek approval of medications on the TGA and PBS for rare diseases. And she has also stated, I have at least 2 families who should be on FDA-approved medication for their rare disease, but due to the prohibitive costs to themselves and the hospital, are missing out on the best drug treatment. Currently, some Australians wait over a year for medications that could significantly improve outcomes. Once approved on the PBS, prices are reduced, but delays remain. Faster TGA approval and PBS listing is urgently required. Testing for genetic diseases is also frequently avoided because of fear that results could impact current or future life insurance. Last year, the Albanese government announced a total ban on adverse genetic testing results in life insurance. This is a small step forward, but without confirmed legislation, fear persists. Delays in testing can result in conditions worsening, symptoms becoming irreversible, or causing long-term disability. Early testing enables timely treatment and better outcomes. We need to break down barriers. We need to invest in real solutions and build a system that reflects fairness, compassion, and care for most in need. Access to the NDIS and other health services should not depend on a person's ability to navigate bureaucratic language. They must be accessible to all.
I thank the member, and I call the Parliamentary Secretary to reply.
Mr. Speaker, and I rise to thank the member for Albury for his very honest contribution tonight, and I think the love of all your colleagues in the Parliament is right here beside you, and none of us can imagine the challenges that you're living with. And I think also in the Parliament I'd like to thank everyone in New South Wales and beyond who works in the sector of genetic and rare diseases, because I can't begin to imagine the challenges and the frustrations and the level of support you provide for families. So thank you for sharing.